7 years ago, Dr. Afable led a group of us, and we met at St. Joseph's headquarters in Irvine. And Dr. Afable introduced a concept that was unknown up until that time, which is to create a countywide mental health system. This follows soon after the creation of the Mental Health Ad Hoc Committee on the Board of Supervisors between me and Supervisor Lisa Bartlett. And the timing couldn't have been better. On the county side, we started to take on mental health, and on the private side, there is a coalition of members who saw the need in the county, saw the impact on our community, on emergency departments, on our jail system, that there were a lot of mental health patients who didn't really get a chance to get treatment, to have the issue addressed in the right way. And so they're forced into the hospitals, into the emergency rooms, and then maybe even in the law enforcement. And of course, those environments did not lend themselves to de-escalate the situation that they might have experienced. That first meeting, together with the director of the healthcare agency, Mark Refowitz, as well as the deputy, Richard Sanchez, and led to today. 7 years later, this is the second campus, and as we can see and look around, the size of it, the magnitude of it, and the scope of the services that we will provide to the residents of Orange County will be tremendous. It will help so much to address the needs that really have gone unaddressed for too long. And we have seen that impact anything from homelessness to recidivism in our criminal justice system. So today is very meaningful for me to be here with Dr. Afable, representing not only the board of directors for Mine OC, but for the staff and the entire team at Be Well OC. We started at a Anita campus, but this campus here is really going to take it and move it to the next level. This is now where the work will really begin, and we will start to be able to integrate countywide more of the services that we have been planning and talking about for years. Data integration, navigation for the communities, and also for the kind of help, the warm line, the 211 concept, even the 988. And in the future, we hope to incorporate all of them into one cohesive system.
Well, it's certainly an important moment for us, and really the coming together of a vision, and it's really a step along the way, the journey that started 7 years ago. I think it's so amazing how you just capture the entire story so well, because you've been part of it. You've been a fundamental piece of it for all of this time, as has all the boards of the supervisors on the board, past, present, and future.
Right.
Which is that there's a major gap, and has been a major gap in this service of caring for people with mental illness and substance use disorders. We saw that 7 years ago. We talked about it. Now we see this.
Right.
Truly amazing, and it's really just a step along on the journey. So there's much more to be done, but we've had some pretty significant accomplishments.
And you speak to the public-private partnership, right? That heretofore really wasn't a thing, until the coalition sat down and worked collaboratively with the Board of Supervisors and county staff. Now, what we see today is really the encapsulation of that partnership that shows that together, what we can build together for the betterment of the county.
You'll recall that we called them silos of excellence. What we meant then at that time was that everyone was trying their best and doing their best and trying their hardest. The county with the healthcare agency and with behavioral health, the hospitals, even the jails. And Sheriff Barnes was a big part of the discussion early on as well. Right. Everyone was trying their best, but we understood that we could do so much more if we could do that collaboratively and together. And that's what the coalition was about, and that's what created Be Well.
Thank you everyone for being here, and Dr. Afable again, thank you so much for letting me be part of the ride.
Congratulations.
Thanks. Congratulations.
Thank you.